Welcome to MD-Esti Besties. We are on episode number 2.
Yes.
So bear with us. We're just learning how to do this, but we want to make sure that this information is really good so that you learn a little bit about us, but also learn a little bit maybe about yourself. And I think this episode is really about you, the listener, and helping you get ready for an episode. So we want to talk about, as providers, how we figure out what patients are actually asking for when they come into an appointment. And we want to dive into maybe some of the emotional psychology behind the aesthetic treatments. So we're going to do this in 6 acts today. So act number 1 is the hidden questions. Act number 2, decoding the language. 3, the life events that bring people in. The consultation as confession is act 4. Act 5, when not to treat. And act 6, trust and transformation. So thanks for coming along in this conversation, Tracy. Let's get started to save these people time. Um, I would ask you what it is when people sit in your chair, how do they open with why they made an appointment with you? Or do they?
They do. So I will say, first off, who referred you here? And then I'll say, what are your concerns? And then they'll just start saying what their concern, what they see in themselves that they want something changed, whether it's laxity of the skin or they could just be here for, oh, I just want to feel good facial.
Mm-hmm.
But that's usually how we start.
Yeah. I would say something that I've noticed that I think is a woman thing is a lot of people when I go in the room and I introduce people, I like to really name something that I think is really beautiful. Like I'm really struck by people's eye color or their smile or something. And I'll say something nice and people will immediately like apologize to me. I'm so sorry. Or like, when we're talking about why they want to be there, people will apologize. They'll apologize for wearing makeup. They'll apologize for not wearing makeup. They'll apologize for not getting done when they come to their appointment. They'll start with an apology, almost like they're a little bit embarrassed when they're a new patient to be in my chair, and, um, that always I know that we're starting the conversation in a very vulnerable place, and so, it's just a pattern that
Hmm.
I've observed over and over again, and so I just wanna let people know that there's nothing to feel sorry about, and I'm excited that you're
Absolutely.
excited that you're there, and I wanna hear all the things. Um, I also feel like this is another thing that I hear a lot. Someone will say to me, I woke up and I feel like I looked old or I look like my mom,
Yeah.
or I just like, I feel like I woke up and everything changed, or I woke up and I feel tired and I can't, like, my makeup just isn't working anymore, or what I was doing before isn't working anymore. Like, I need you to fix it.
Yes.
And I feel like those are the things I hear, in repetition over and over again when people are sitting in my chair. So that's like usually an opener for me with what patients are telling me. And that's a big bucket.
Yeah. Yeah, that's great. Yeah. And you're right.
I think, yeah, yeah.
I just had the deer in the headlight. Like, sorry about that.
I'm so good though.
No, no. But sometimes too, if I notice they're nervous or they're a little like, oh, I just try to. Sometimes I'll even say, okay, let's just breathe. It's okay.
Right,
Let's just talk it out.
right,
And let's just then it kind of gets them like, okay,
right.
she's really going to listen to me, and I'm going to tell her whether they go into what's going on here or what's going on in here. It tends to just flow.
I love that. One of the things that, I don't know, hopefully you can get this sense from our interaction, but for me, I think the title of doctor, although I'm really proud of it, and go all of our high achieving girls and all of that, but I do think it's kind of like an impediment. I think sometimes people are embarrassed to get into the feel stuff
Hmm.
at first with
Yes.
me.
Yeah.
And one of the things that we do in the practice is we've got an amazing mm, um, just medical assistant, an aesthetics assistant. Her name's Nicole, and she's a doll and wonderful. And I purposefully have added her to the practice so that people can feel safe talking with Nicole
Yes.
sometimes. in ways that they wouldn't talk with me because I'm the doctor and I walk in the room and they're like, "Yes, ma'am." Like,
Yes, yes.
I am here for some Botox. And what they've told Nikel is I am here because I'm going through a divorce and my child just graduated from college and I suddenly just don't feel like myself and like I've got all of these things going on in my life and so Nikel can break the ice
Yes.
so that I can come behind her
Mhm.
and parse through what is the request and then maybe what are some of the other things that are going on behind that request so we can really get to the meat of the matter about why they made their
Yes.
appointment,
Yes.
right?
Yes.
And I just want to say that no one should ever feel intimidated to I would love that you would get to the place where you didn't feel intimidated to tell me why you were sitting in the chair and be really honest and vulnerable about that.
I've even said that to employees that we've had. Like, I think you're right. It's like who you are and how you carry yourself. And I'm like, she's human just like we are. I
Mhm.
promise.
No, it's
And as soon as they'll hear you say something that they relate to, they're like, oh, did that come from her?
Mhm.
Like, yes, because so same with patients. I get that. And I think you're right. It's because Dr. Neiman. Okay, yeah, absolutely. They are a little bit more intimidated by that.
Mhm.
And honestly, sometimes too, I will say, like, I've had a couple of my patients that have come to me after seeing you, and they're like, "But she's just so beautiful. She was so intimidating." So I think a lot of that is as well. I'm like, she's beautiful, but I mean, she's the best ever. They
Oh,
just getting to know you inside.
yeah, no, I mean, that's super sweet and what a compliment. But I tell everyone who sits in my chair, I very much will say I have Dysport every 4 months. Will do Sculptra once a year, Halo twice a year, BBL as often as I possibly can fit it in. So, um, I'm super honest with patients, and that's
Yeah.
super sweet. But it's just something I don't, I love when patients are just feeling like they can be honest with me. So that's something that I
Absolutely.
have to work on.
Just
Is
walk in
just
the room like a baseball catcher,
yeah, something yeah,
just
exactly.
rapping.
But, chipping away at at that factor, for me, that's something that that I can continue to work on, right? About just kind of, like, helping to ease that tension
So just
and
not being
making
beautiful?
well, Tracy, you're so sweet. Mwah. And I appreciate the compliment, but it really is about the patient in front of me,
Yes.
and I think that that's the thing, that I want people to walk away with from this conversation today
Yes, yes.
is it's not about me. It's really about you in the chair, the patient in the chair. And so my focus is completely on you in the chair.
Absolutely.
And so I definitely want to make sure that people know that and that doesn't get in the way of our conversation.
Yeah, absolutely.
Tracy, what about the like I just want to look like myself again or I just want to look rested? Do you hear that a lot?
All the time. But I've even had moments personally where I'm like, how did I age so much overnight? So I relate to that. I
Mhm.
understand like what they're going through, and but it's a lot of times it's like I just realized how old I am, and now it's showing.
Yeah.
Or I was with my friend who's the same age, and she does this, 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 and she doesn't have wrinkles. So yes, there's a lot of
Oh
that
my gosh, comparison is the
comparison.
thief
Yes,
of joy, right? Is what
yes,
they say.
yes,
But I think that's such a good point because a lot of people do come in and they're like, my friend does this, or my friend does this and I did this, but I don't look like my friend.
yes.
People are individuals, and so we can't always do
I
the
can
same
speak
thing.
for that because I always say, when someone leaves and I'm like, "Oh my god, look at their lips. You could do that to mine," or whatever, but I know that, like,
Yeah.
everyone's different. I can't get what they get, it's just the anatomy. But that's true. I mean, we all have those feelings,
Right.
so
But we all have such beauty. I don't know. One of the things okay, so little tidbit about me. I love to take pictures. If you know anything about me, if you know, it's funny. I was answering, what's your perfect Sunday? My perfect Sunday is actually being at my son Noah's soccer games, taking pictures. It's just this thing that I get to do right now. But I love taking pictures of people. I love taking portraits. And so what I would hope if you're listening to this, if you're a patient of mine, if you're watching this, you can see how intense I am about this, but I love people. I love people's faces and I see so much beauty in every single individual face that's in front of me, every single individual that I photograph. I feel so honored that I get to do that. and get to share those photographs with them. And I really at baseline like find significant beauty in people and their soul and their spirit.
Yes.
And I don't think that there's one right aesthetic. I don't think there's one standard of beauty. And I think sometimes we hold ourselves to a higher standard of beauty. Collectively,
Sure.
or have like one view of what we think is beautiful. And I just want you to know that I allow for many different types of beauty to exist at the same time. And I can pull it out and appreciate it in the patient who's in front of me. And so I want you to know that because I think that that's really important. I would never want anyone to feel like all of the patients we treat here end up looking the same.
Oh, absolutely. And I tell people that too. I'm like, if you want the natural, the most natural, you see Dr. Neiman, so absolutely. Yeah.
Yeah.
It's
Yeah.
what's unique about our place, I think.
I love that.
Yeah.
I love that. Let's talk about Act Two here, decoding the language. So when people come in, I find that there are some behaviors that we see repetitiously. A lot of that is people will kind of, oh, well, when I look in the mirror, I like, can you do this for me? What are some of the things that people like do that you've seen kind of over and over again? Maybe it's talking about skin. Maybe it's like asking you about questions about like how would you treat like, I just want my Botox to do this, like, or like these things that people tell you. How do you decode what people are really getting at?
What's underneath.
Yeah.
So I do. I'll have people too, even though I don't do injections, but they'll come in and they're like, "Well, I don't like this, and I'm standing in the mirror and I'm doing this." I'm like, "Well, don't do that." But first off, let's stop. But a lot of times it could be how they're feeling inside, and they're like we talked about before, waking up and they feel different.
Mhm.
But a lot of times, what I find once I start talking to people is sometimes it could be their insecurities, but I think it's what other people have said to them
Mhm.
or how they've made them feel. And then it could be something they didn't even really think about until
Right.
someone brought it up. And then so then it's constant in the back of their heads. And
Mhm.
so they're like, okay, now I've got to fix that. I've got to fix that. And they're not really seeing what their actual beauty is that they have. They're now focused on what someone said to them.
I think that's really such a good insight in that I don't think any adult is really over that. I would call it like playground ish vulnerabilities,
Sure.
when someone said something mean to you when you were 8 years old and it stayed with you. But when you have friends in adulthood and maybe they make a comment or you're in the middle of a conversation, someone says something offhand and it just strikes you and like it just hurts for a split second. And then sometimes people find themselves in our chair and they're saying, I don't like my cheeks. Like, I just feel like, I feel like something about my cheek. And then you get further down the line and maybe someone has had some weight loss and then
Mhm.
one of their friends is making a comment
Yes.
about something and now we're in here with a problem that existed because someone made a nasty remark.
Right.
We just need to be kind.
Absolutely. And I had
Right.
that, yeah, I've had that happen to me
Stop.
with like an ex coworker. You know, I
Really?
would much rather work with an ugly esthetician than a pretty esthetician.
Oh my
So I was like,
gosh.
okay, so I guess that means that, but whatever the case, I'm like, I am me. And that did, sure, I'm like, ouch, but that's their insecurity. That's not really mine.
That is
So
100% somebody else's
yeah, absolutely.
insecurity.
Yeah.
And
And I just
I
know that.
reaffirm that gorgeous from the inside and the outside.
Well, I know who I am. So yeah.
But yeah, I
Yes,
know
yes,
it's
yes,
comfortable in
yes.
yourself. But any of us can fall prey to, like, I
Absolutely.
remember mean things that someone said in like the 5th grade. Do you know what I mean? Like
Yes,
I
yes.
still carry that around in my heart.
Absolutely.
And our adult friends can do the same things or, moms or sisters or things like that. And so
Yes.
it just is so important that we spend our energy building people up,
Absolutely.
I think.
Absolutely.
Right?
And if they are your friends and everything, they should be like lifting you up.
They should be. I'm going to say this, and I want my patients to know, or anybody who's thinking of going to a medical aesthetics practice, but it is a tricky thing sometimes to toe the line as a provider when someone's come to me and they've said, I've looked tired, or I feel like I aged overnight, and can you help me? And I'm using the language to say what we have opportunities to improve without making someone go home and focus on those things that we talked about
Yes.
here
Yes.
and go, I have a problem that I didn't even know I had a problem
Exactly.
about because Dr. Neiman said
Right.
we could address something else. And that weighs on my soul. And so I want, it is part of this conversation. I want people to know as I'm decoding what it is that you are actually bringing to me, I want you to know that I am looking for opportunities to treat and to help you feel the best about yourself.
Absolutely.
And so nothing I say is coming from a negative place. It's all coming from a place of at the end of the day, I want you to be thrilled with what we've done together and feel the best about yourself.
Well, and I've listened to you, so if someone's jowl area, well, you have to treat back here, and so a lot of people don't think that. They just think, "Oh, just put the filler right here, and we're gonna be good to go." So then you're saying, "No, you gotta do this to pull it," and so
Right.
they could think, "Oh god, well, now I need cheek implants or something," and it's not the
Right.
case. Yeah.
Well, the jowl, like that's such a great like thing to decode though, because
Mhm.
people will be like, I feel like my mom, or I feel like I
Yes.
woke up and I look really heavy down here. And they've really feel like that makes them look a lot older. And I think the thing is truly in 2026, right? Like people feel very vibrant
Yeah.
and are living really creative, amazing lives. Longevity is a thing. People are, fit, they're eating well.
Yes.
People want to feel really purposeful. They want to feel really like their best selves. And I think once we put people in a box of aging, it's like that really takes away from longevity and vibrancy and purpose and meaning and all of
Yes.
those things. And so someone comes in, that's what they mean, right? Is this notion of I feel really vibrant and alive and I'm at my best place in my life is women in their 50s and 60s who are coming in who have accomplished like we've got
Yeah.
I'm just going to say I can't say because of HIPAA, but I will say we have patients who have done some freaking amazing things with their lives, and they're so impressive, and they have done things I feel like I wish I could write books about. I'm so, like,
Maybe one day.
blown away by the things that they have done, and, um, and they are vibrant and purposeful and all of these things, and they come in and they say, "I look tired," and they don't want to be told they're not vibrant and purposeful and
Yes.
doing and active, and they have so much to bring to the table because they're afraid that people are judging them for being older and then they don't have much to give.
Yes.
That's something to
That's
decode
yeah, that's
right there.
that's awesome. Yeah, I love that. I love that analogy.
Yeah.
That's head on. Yeah.
But that is, I feel like that's a future podcast
Yeah.
episode in and of
That's
itself. I can get lost in the decoding, but let's talk a little bit about, I think this is sort of a fun thing for me. And I think a fun thing for you. I'm going to flip through my pages here as we talk, but we often get life events that come through the office. And life events, I'm going to tell you about a couple of or a couple things. Tracy's going to tell you about a couple of things. But we have patients who have been with us through multiple life
Mhm.
events,
Yes.
like weddings, births, death of parents, death of partners,
Mhm.
um, uh, weddings of their children, like
Right.
like all sorts of grandchildren being born, people getting their first jobs, graduating from college, like doing all that. So many life events. Tell me about just maybe one of your like favorite stories or like things that is meaningful to you, and then tell me why why you think people come to us and share so much about these events.
So I have one that she was getting married
Mhm.
and she had really bad acne and she wanted to clear it up
Yeah.
prior to it. So, we did a sheet where I said, okay, this is what you're going to do monthly for me. First off, we're going to start with skincare because that's your foundation. And throughout this process, I think she was with me and she still comes to see me now, even afterwards. But I love getting brides on a plan, talking to them, getting to know them.
Mhm.
I want to know their journey. I want to know how'd you meet your partner? How this and this and this. And so the one particular one, she was just like, just her face, she was like, I have acne scarring, and I don't want to look like that on my wedding day.
Mhm.
And so I think I really got emotionally involved with her as well because I was like, oh, we're going to get this. We're going to target this. We're going to do everything we can.
Mhm.
And at the end of that, it's probably a good 9 months. I mean, her skin was flawless for her wedding. She looked beautiful.
Mhm.
but she did all the things as well. But it was just her deep insecurity about it, and this was her special day,
Yeah.
and I wanted her special day to be even more special for her, and
Mhm.
so I felt like being a part of that journey was just awesome, to me,
Right.
and I feel like I gained that trust too because I'm one that doesn't say, "Yeah, we should do this, we should do that." No, I'm gonna tell you why we should do it, and
Mhm.
this is why it's gonna work. And I'm not gonna subject somebody to something I have never tried.
Sure.
And so I build that relationship that way as well. And I want people to feel comfortable. But she's one that really sticks out because I just listening to her and knowing what her insecurities were. And then we were able to work through all that. And she was just a beautiful bride on her wedding day.
Yeah.
And she's so beautiful. But, it's just the fact of,
Yeah.
I mean, and she did a microneedling treatment the day before her wedding
Love that.
shower, her wedding shower. And I was like, "You want this the day She's like, "I don't care what I look like for that." She was preparing for the wedding.
She was sticking
And
to
I
the
love
plan.
that.
Sticking to
Yes.
the plan.
Yes.
No, I love that. And I also love how you just personally invest in that person's
Mhm.
event as
Yes.
well. And
Yes.
I think it's one of the things I love about kind of this business. And I think most of the other practices that I've visited, I think that's something that we as caregivers really love to feel like we can be a part of your event
Absolutely.
and watch from the sidelines and cheer you on. And I think the other thing too is like we're such Instagram's a big thing, TikTok,
Mhm.
just
Yes.
having beautiful photographs. People, I think, are really afraid of being photographed
Mhm. Absolutely.
and to have big insecurities about how they're going to look in photographs. And we've all been subjected to bad photographs
Yes.
and photographers who maybe didn't capture us at our best angle.
Right.
And I think that's a lot of a bride's, fears is not looking flawless on
Yes.
their wedding day and having those photographs which hold those memories of that day. So that's such an emotional
Absolutely.
day. And people are coming to us with their trust, but also with their hopes. Like they have an idea,
Mhm.
right, of what that perfection on their wedding day is going to look like.
Yes.
And so, what perfection on a wedding day might look like in my eyes, and what perfection on a wedding day in your eyes, and what perfection on a wedding day in your client's eyes looked like may not all be the same.
Right. Absolutely.
And so, I think there's like a process in that too. And like, you have to really know someone
Mhm.
and you have to get to know them in order to understand what that result for them looks like. Because it's not this,
Yes.
my idea is not your idea, is not her idea. It's really important because it's individual.
Yes. Yeah.
Yeah.
So how about you?
I have a lot of really, really happy stories of weddings and, gosh, I have so many, but one of the stories that like, it just sticks out to me because it was so unique. It was such a unique situation, and, it is something that you might say is a red flag, and I might not do this for every single person, but I had a patient who had been with me for a while, and, so we had trust, and we knew each other,
Mhm.
and, her spouse had passed, and, their funeral was gonna happen kinda quickly, and so I don't wanna say too many details, but, she gave me a phone call and, wanted to come in and see me for filler, and I tried to talk her out of it. I was like, "This is, like, a lot is going on in your life. Like,
Sure.
this is not the time to make decisions, like, give yourself some grace." And she said, "I just can't face my family without feeling my best. I just need this for me." And so she came in and, we did a little treatment. And at the end of the appointment, we hugged and we did our thing. And I mean, honestly, like we didn't do a full phase rejuvenation. We didn't do we did
Yes.
nothing crazy. We just did a little bit, but it was like what she needed
Mhm.
was the confidence to meet her family.
Yes.
It wasn't about the cheek filler. It was
Mhm.
about the confidence to meet her family and stand there and feel okay in that room and feel not judged by people
Mhm.
and feel like she was feeling her best
Yeah.
and doing all the things that she needed to do to make that day as okay as it could be. And I felt so honored to be a part of that for her, and I know that's like a silly,
That's a silly thing.
sad
Mhm.
kind of event that's not like normally it's like happy birth, wedding, all the things, but it just like really struck me. That was kind of early on in my in my career with Blossom Medicals, doing aesthetics, and it really just like drove the message home that what I'm doing here is not filler.
Right. Yes.
What I'm doing
It's
here is
deeper.
shaping how you feel about yourself,
Yes.
and that there's real responsibility in that to like do that um wisely and to know when to say yes and to also know when to say no.
Right. Right.
But I think it's important. Let's move into act 4 because I think we should move on to the consultation as confession. And Tracy, I think you and I, oh, Trace, by the way, this is my aside to the camera. Tracy Barnes is like the keeper of all people's secrets, I would say. And like we call her our resident therapist because people just love to talk to Tracy and to tell her things and to go over their life with you and to make decisions and all the things. And we, under no circumstances, misrepresent Tracy as a licensed therapist.
I'm not.
But as far as your girlfriend who always has the best listening ear and can really offer some sound, just safe space to talk, in. That is something that you are truly, it is one of your gifts, just God-given gifts.
Thank
But I think that people in this particular industry will tell us a lot
you. Mhm.
about themselves. So talk to me a little bit about the responsibility of that, first of all, and then how do you use that when you're decision making for people?
So that's a good question. So they do to eventually. Sometimes I feel like, do I just have it on my face that says "Tell me everything"? And that's fine. I'm here to listen. But I do tell people when you're in my room, it's like Vegas. What happens in that room stays in that room. So whatever you tell me doesn't come outside of that room.
Mhm,
So I've had people tell me a lot of things, maybe things I shouldn't know, but I'm just like, oh my gosh, okay, they just need somebody to talk to.
mhm.
So during the consultation, if they're telling me like what they're here for, or um, sometimes it is like a breakup or someone cheated on them or something. So we'll get into all of that to try to get. I hope this is making sense. Just to try to get deeper into what they really want out of this or what they're looking for.
Let me ask you this.
Hmm.
Do people, so in my room, people don't lead with that.
Hmm.
They lead with, I'm here for lip filler. And then we'll be like, they'll be numbing. And 20 minutes later, I'm like, we're taking some numbing off. And then they start telling me about how they met someone on Match.com or something like that. We don't like get there. Sometimes we get there eventually, but
Right.
sometimes we don't start there. And I'm like, oh, okay, okay. Now I understand why before it was like I never wanted to get lip filler. And today we're like, I would like to have some volume in the lips because they matched with someone. And so like
Yes.
that happens, but sometimes it takes a minute to get to that,
Hmm.
like what's going on, but that often helps me make better decisions for you.
Yes, absolutely. Yeah, you're right. So like if someone says like, "Oh, I'm dating, I'm back on, I want
Yeah.
to look my best," then I just kind of okay, so do you want to start with this? Do you want to start with this? And there's a lot of times where I'm like, well, I think you need to see Dr. Neiman for what you're looking for. So
Yeah.
then I will send them to you. But it is like listening and just really trying to get to the root cause of why do you want this now? Is it because you want it, or is it Zooms? People, they'll see themselves
Yeah.
and they're like, oh my God, I didn't know I looked like that so then they want to fix that.
Mhm.
And that's like their insecurities now have come out because they're seeing themselves and they're beautiful, but they're seeing a different version. If I look in the mirror, I'm going to see something different than what someone might compliment me on.
Mhm.
Today, I've just had one of those days where I was like, I'm so tired in my mind. I didn't say it, but, and then I had someone say, oh, your skin's beautiful. And I was like, well, this morning, I didn't say this to them, but this morning I was like, oh, I've got a lot of pigment showing. I was really being hard on myself.
Yeah.
Then for someone to say that. So it's just really getting down to that deep root of the situation itself.
Mhm.
Makes sense.
Yeah. Is there any question? Is there like any specific questions that you ask patients to try to get to those answers, or is there any tip or advice that you would give to somebody who's maybe watching or listening to us about what should you do when you come in if you are you, you're having a change in your life or you're going through something like how and you have an aesthetic issue and you come in and you're like, I want a facial, I want a hydrofacial. What should you share with your practitioner?
I mean, with me, they can share anything.
Mhm.
Honestly, just tell me, is this a revenge appointment? I got you. Is this you wanting to build up to something? I got you.
Mhm.
But I'd say just be honest and tell me what I, I'm here to help you. And if you're going through a divorce and you want to tell me that, tell me. I will make him regret this divorce.
Yeah.
And
Yeah.
that's
Yeah.
what I tell them. So it's like, just tell me anything.
Mhm.
Like I said, no judgment zone in that room.
Yeah.
Any of our rooms, but I'm just saying, like, no judgment. Let it out. It stays in there, and
Yeah.
we'll go from there.
Um, just I just want to piggyback on that for just 1 second and just like the consultation as confession and or people like even leading up in our previous active like having events and things like that. Please don't come in on the day of
Absolutely.
if you can help it.
Yes.
I
Yes.
guess my story was a bad example, but like people who are coming in, they've got a date or they've got like a party or they're giving a big presentation and they come in and they want to have a procedure done. Like at least give it a couple of days. I was so happy to get you there, but sometimes mentally that's just a lot going on in terms of you getting a result and not having any, other swelling, redness, things like that.
Mhm.
Give us a minute
Yes.
so that we can get you ready for your big moment.
And I'll have like a lot of my brides where they'll have their makeup artist. They're like, okay, I want dermaplaning
Uh-huh.
prior to your first makeup session. And so that's why I tell them, don't come in the day before.
Yeah.
I want you to come in the beginning of the week. If you're going to see her Saturday, let's hit this on Monday or Tuesday.
Mm-hmm.
Give me some time, give it time. So absolutely.
Right.
And like if it was a hydrofacial or a diamond glow, I'm not going to have them have that the day before their wedding
Right.
or a laser day before their wedding.
Oh my gosh.
So yes, it's all about the timing as well.
Important stuff.
Yes.
Let's go into our Act 5, when not to treat. So, Tracy, tell me what some of your red flags may be when you've got patients.
So I do remember a patient that I had and she came in she wanted a BBL.
Yeah.
And
BBL in our world stands for broadband light therapy, which is a laser platform by a company called Cyton, and it does not refer to a Brazilian butt lift. I just
yes,
wanted to clarify for
glad you
anyone
clarified
listening.
that
Yeah,
because some people do think that. Yes.
no,
Yep.
they do. I say BBL and they look at me and I'm like, no, no, no,
Yep.
like broadband light.
We're not doing that here. Um, she came in for the BBL because she wanted to treat some pigment
Mhm,
and she loves the sun.
mhm,
And she's not on a skincare regimen and she barely wears sunscreen. And
mhm.
so, as I'm evaluating her skin, I'm asking her, when's the last time you went to the dermatologist? And it's just been a couple years. I'm going to go to the beach in 2 days. I said, oh, but you want to be BBL today? And I said, absolutely not. I have no problem saying no if I'm not comfortable with it. First off, I needed her to go to a dermatologist because not a dermatologist, but she had areas of her skin that needed to be addressed.
Right,
And I wasn't going to go over it and cause any damage. And I'm not going to do this treatment on you 2 days before you're going to the beach.
right.
And she's like, but I'm going to go to the beach, but I'll stay out of the sun. Doesn't work for me. That's a no.
Mhm.
We'll schedule this when it's appropriate.
Right.
And after you've seen your dermatologist, so, I've had things like that where I've just said, no, not today. Or someone's come in, they have a lot of acne and they were thinking, oh, I'm going to do extractions today. Extractions isn't the thing for you right now. We need to calm all this down. So I'll start them on a skincare regimen and have them come back in 4 weeks.
Mhm,
So I'm not afraid to say no during a consultation.
mhm.
Same with you, I know.
Yeah, well, again, medical aesthetics means that we practice medicine. So we do a full assessment. And in that part of that assessment is deciding the appropriateness of treatment and then recommending appropriate treatments. And one of the things that makes us different than, I would say, a restaurant or a salon that you go to is that even though we present, and we do, we call it a menu because we have prices. We like to be incredibly transparent, but it's you. I don't necessarily think it's appropriate for people to come in and just pick, "I would like the cheeks and lip combo today," because you may have beautiful, gorgeous mid-face volume, and you don't need any volume up there, and doing any would be excess.
Right.
Or people who have really maybe they've had lip filler in the past, and, they really have expanded lip compartments that maybe need to be reversed before they have new treatment done. There is a duty that I have to assess and to recommend the most important, treatment pathway. One of my red flags is somebody who, um, doesn't want to hear about the assessment and the recommended treatments and wants to, um, tell me what the treatment plan should be. That's a red flag to me because although I think it's most important that that patient trust me, I have to trust the patient too, because anytime that I do a medical treatment, I'm putting my license on the line.
Mhm.
So we have to have a mutual relationship. And so I have to know that that patient is trusting me to make an appropriate assessment and treatment plan and doesn't feel that they are going to dictate what should happen in that appointment. Um, a lot of times, or one of the things that happens or red flags to me are when people are really focused on this area of the face and structurally, we know that we need to support other areas when we're doing filler. And this is a different, longer conversation. But over time, there's a potential for me to really masculinize someone's face.
Mhm.
And as much as I want to treat someone, I won't necessarily focus on just an area that someone points out because I'm not only thinking of today's treatment, I'm thinking of what you're going to look like 5 years from now, 10 years from now.
Yes.
And so I feel that it's my duty to look after your safety. And so I may say no to something that you are requesting because I'm thinking of the short and the long term outcomes. And so that's something that I want patients to know that it's really important, and that may be a red flag to me. Another thing that's a little bit of a red flag to me is when someone sits in my chair and has really negative things to say about somebody else who took care of them. Not to say that there aren't people who have had really bad experiences somewhere, and I do want you to feel comfortable telling me about something that may have happened that you didn't like. I will always ask you if you had Botox in the past or you had
Mhm.
filler in the past. I will ask you, what did you like about it? What did you not like about it? What were your favorite aspects of that treatment? What were you hoping for? But if you have gone to a number of different locations and have had a number of negative experiences and you tell me about all of those things, but maybe you can't tell me what you liked, what you didn't like specifically, what you're hoping for,
Mhm.
then I see that as a bit of a red flag and that you're not going to like what I do for you either
Mhm.
because whatever happened in the past, what we need to kind of dissect down to is what are you looking for? What are the results that you're looking for? That's the discussion we need to have. So we don't need to talk badly about anyone else.
I agree.
We can talk about what you didn't like,
Mhm.
and then we can talk about maybe why that happened, and we can talk about what we're going to do differently to try to get you a different result. Even Botox people, I will say some people, come in and they have a short, short, short forehead and they've got a really heavy brow and their brow already rides really low and they've got heavy eyelids
Mhm.
and they want to get rid of all the wrinkles on their forehead and they want a brow lift because their friend got a brow lift with Botox. I can just tell you that I've just set up the anatomy for somebody. We're not going to get you a brow lift with Botox. There are places that we can and can't treat, and everyone's muscles are different.
Mhm.
And so it's also, I take that as a little bit of a red flag when someone wants to tell me about a treatment that their friend had and they're expecting the exact same results.
Yes. Yeah.
Your treatment results are your treatment results, and I always will try to make sure that we are on the same page about that, so that
Yes.
you're happy
Right.
at the end of the day. So
Yes.
those are some of my
Yeah, and you're only doing it out of concern. I mean, I can speak from that. I've walked out of her room stomping my feet pouting before because she'd say, "We gotta dissolve this." I'm like, "You can't dissolve." No, we're not dissolve." But I let her, and then I know because she's looking at the long, the
The
long run
long
and what
term,
the yes.
yeah.
So, but yes, absolutely.
Yeah, and I think, sometimes we do need to sometimes we need to do some course correction.
Yes,
Sometimes we do some course correction from previous treatments, outside of our office, and that's all just fine, and I'm sure people have had treatments done with me where they've course corrected maybe with another office or injector because their bodies have changed, they've lost weight, they have a different point of view that
sure.
and so, um, I think that that's all possible, but at the same time I just want patients to know that I am on your team,
Yes,
right?
yes,
And so the red flag for me is when we're not on the same team.
yes. Yeah,
When
that's
we're
right.
on the same team, we can talk about your bad experiences or we can talk
Right.
about things that you like, things that you just, even if you had an outcome with me that you didn't love, same team,
Yeah.
we need to be on the same team.
Give us that chance to fix it or reach out to us. Don't go someplace else and say this, because we don't accept that here, and we have relationships with so many med spas, and
Absolutely.
I'm not going down that rabbit hole with anybody,
Nope, I don't like to go down that rabbit hole, and oftentimes I will hear myself saying, and, I'll tell patients that, I dissolve my own work on patients or someone's had lip filler for a while, and just over time, it just doesn't look as, like, crisp and clean the way that we want it to look, and I'll just look them in the eye and say, "We have to start over."
Yeah.
And not everyone is happy with that, or maybe not we have to start over, but we have to take away a little bit. I've had to take away a little bit on myself, and so I know.
Yes,
But the
yes.
point is, that doesn't mean anything was done wrong. It
Right.
just means that, sometimes you gotta clean out your closet,
Yeah,
right? Like,
yeah.
sometimes you gotta just, like, tidy up a little bit in order to have fresh,
That's a great analogy.
clean, lifted,
Yes.
all of those things. So, um, anyway, that's kinda where I stand on that. And so, Tracy, talk to me a little bit. We're moving on to act 6, where we're just kind of, like, landing this and bringing this home. So, tell me about, maybe why we are not just prescribing products or procedures, but why the patient in the chair matters so much, and why that idea of the menu, coming in and picking and choosing this and this and this doesn't matter so much. Like, can you put that all together for us of, like, figuring out what the patient actually wants and needs?
Mm. I'll throw that on you right now. I need a minute. You answer it. Yeah, here you go. I gotta think about that
Well, I think, like, so if we kind of review back and we're thinking about when patients come in and I feel tired or I feel, like I feel like when I woke up, I aged 10 years or something.
one.
Getting through to some of that, I've had patients tell me, like, when I look in the mirror, I feel like I look like my mom, and I don't have a great relationship with my mom. And when I see this looking back at me in the mirror, it makes me feel a certain way.
Okay.
And so now we're not talking about Botox anymore, though. Now we're talking about Sculptra and we're talking about some microneedling and some device. Like, now we're talking about why we need to why we need to maybe focus on a different
Mhm.
pathway and maybe not focus on, you know, other things in the office because I want you to get to a place where you're seeing some results and change in this direction. So when we build out your 6-month plan or your 12-month plan, I want to address the emotional part of you that brought you into the office in the first place as fast as we can get there.
Mhm.
And then we're going to continue on with some of the other things. So if someone came in and they told me, I just, every time I look in the mirror, I see my mom here and that I have a feeling about that, then I don't care how much pigment you have in your skin.
Right.
I'm going to start there.
Uh-huh.
And then I'm going to build my treatment plan around that so that we treat those emotional parts of you, we develop trust, we move on. And then when I make some suggestions of like, hey, I think we need to start bringing Tracy into this conversation and working on a little bit of tone and texture, or maybe we can talk about a halo or BBL or something else that we're going to start bringing. It makes sense because we've treated the emotional thing that brought you here in
Yes.
the first place. So my treatment plan has to be in alignment with where the patient is emotionally, and we have to spend some of our consultation getting to that place. and we have to develop trust. We have to do all of those things in a short period of time. And sometimes that's hard and tricky. But the thing that I want someone to take away from who may have made it through this conversation with us and is still listening is that the more that you're willing to share that with me and the quicker we can get there, the stronger the treatment plan I build for you will be, because now I know what we need to treat.
True. And I guess too, if someone comes and sits in your chair and you might see something, because you're an artist, you might see something right away. But because you're just looking. And I always say to you, just whatever I need, just tell me, right? But they could come in and say something that's bothering them that you don't even notice.
Mhm.
So you're right, it goes deeper. So no, I get it. But s- it's putting that whole plan together for them. So yeah, that was great. I can't top that one. So you did great. You
Yeah.
did great.
Thanks.
Yeah.
Thanks, Trace. I appreciate it. But I do think that one of the things that sets us apart, and hopefully, like the place that you go, I would say, if you are looking for a home for your aesthetic services, your consultation process should feel like someone is trying to get to know you and the reason why you made an appointment and booked that and came in.
Absolutely.
And if you are coming in and just like, I think just like,
Mhm.
I'll take the
Yes.
whatever, and they go, okay, I would say for a patient, that's a red flag for you.
Yes.
You should be an N of one, right? Like you are not you are not like the
Assembly line.
thousands who come through the door.
Yes.
You need to be uniquely you, and your provider needs to be getting to the bottom of, why you are there,
Reason. Yes.
what
Yes.
your reason for being there is. And then from your reason for being there, building a specific plan for you. There's certain skin health things that applies across the board, I think. I'm going to say that's true.
Sure.
There's certain like making sure you're on good skincare, maybe doing some laser treatments or microneedling that is really across the board good for just overall skin health. But we need to be addressing some of those deeper things. And if you don't feel that, then I would say make sure you're at the right place.
Yes, absolutely. Absolutely. And that's how I feel like I wouldn't want to go in and just feel like I'm there and this is what they do all day and everybody's getting the same.
Mhm.
Go in there, get to know, feel that comfort. And I really believe here that we stand out for that 100%. I believe that from the bottom of my heart because we really do care. I don't just shut my laptop and go home and don't think about anybody. I'm constantly, okay, I wonder how this one did. I'm going to reach out to this one because she had a treatment yesterday. I want to make sure she's okay. So, and that's building it too because I want to do those follow. I want them to know I care. I'm not
Right.
just going to bloody you up with microneedling and send you out. See you next time. I keep that constant contact with them.
Yeah.
And then I'll give them my card. Text this number after hours if you need anything. I've got you. And that's reassurance, and that's also letting them know that, wow, they actually care.
Mhm.
So, and I think we go above and beyond with that, and I'm very proud of that about
Yeah.
this office.
I'm really proud of that about this office too. And like even today I got a compliment about you answering someone's call. We have a phone system by a company called Podium, and Tracy quickly answered a patient's concern last night, and they told me about it, and they were like most places like close and we wouldn't hear about it till the next day, but the fact that you reached out was really meaningful, and meaningful enough that she brought it up in her appointment with me today.
Yes.
And the other thing I would say, this is like Nikel's shout out day.
Let's give it to her.
And so Nikel shout out podcast, but we as in our office, we instituted just or encourage anybody who's had an interaction with a patient that's touched them in some way. We have cards and we write out cards to patients. And so people tell us a lot of things about pets that have passed, about family members, about surgeries, about family members having surgeries, about just things that are going on in their lives. And Nikel is just, she is an angel, but it stays on her heart. And this is just who she is at baseline. But she handwrites a card out to people. And we used to go around and have people sign. And I was like, Nikel, that's from you. You sign it. Like you sign it and send it to the patient. And it is so meaningful. I've had so many people tell me about the cards that they've received and have been really grateful. And I think that's one of those things that as a patient, like I hope that you are at a practice where someone sends you a card for just the events and the things in your
Yes.
life, not a birthday card, but just you were in the office and we talked about this and this happened. And I just want you to know I was thinking about
Nothing.
you.
Yes.
And I think that we do try to do that for people
Mhm.
because again, we are seekers of knowledge and understanding who our patients are. And we want to connect that with the procedures and the treatments that we have here
Mhm.
that are going to help them feel the best about themselves.
Yes.
And at the end of the day, sometimes that's a little bit of a puzzle
Mhm.
that we have to put together. And the other thing, I will say, I feel like I've run away with this episode, so I'm so sorry, but I have so many thoughts about this.
I'm
But the other part of that puzzle, and you can correct me if you're wrong, but I think as a team, put those pieces together. You'll notice in our office, and this is another thing for, I think, for patients to think about is the office that you walk into, the energy between the practitioners in the office
Yes.
we collaborate. So we will have in our morning meeting, one of the questions we ask is there a patient that anyone is taking care of that we have concerns about that we need to know about as a team or that other team members are going to collaborate with in order to help with a result or are just going to help take care of or guide them through something. And so as a team, we take care of pieces. So people, so not only is it we want to understand you,
Mhm.
we want to understand your goals. We want to understand how our treatments can help you meet your goals. And then we want you to understand that all those puzzle pieces are not only fitting together, but all the pieces here
Mhm.
on the back end of things in our business
Yes.
are going to also fit together
Mhm.
so that we can, strongly together
Yes.
give you the best results and that we are going to take care of you. And in that handoff from person to person here. So I hand off a lot of patients. I just don't have the time in my schedule sometimes to talk about skincare.
Right.
I'm going to hand you off to a trusted colleague
Mhm.
and let you take that part of the practice over in order to help get that patient the best result. And so I feel like I'm having that vision in my hand of like someone crowd surfing, like at a concert, right?
Yes.
And it's just like, yeah, you're just going from person to person, like,
Yes.
don't worry, we got you. Like
Yes.
we've got you. And so I think that you should feel that way as a patient.
Absolutely.
And if you don't, keep looking.
Yes. Well, and I had one today. I said to Ashley because she's here. She's our PA that's here once a week, and she had a skincare consultation with a girl probably about 2 months ago, maybe. And we discussed, and she was like, "Okay, what does she need to be on before she has like a 3-step ZO peel?" And so we discussed it. Ashley put her on this program, told her how to use it and everything, and then she said, "Set your appointment up with Tracy." And so today, I had reached out to the patient. I think it was Monday,
Mhm.
asking how things were going because I knew she was like on day 3, and I was like, "Okay, this is where the
It's going to
patient
get
is."
intense. Yeah.
And so she said, "It is rolling off just like you said," because I told her my experience where you all were like, where you were like, "I just want to pull it," or
Yeah.
and I was flaking everywhere, and it was the best moment ever.
It's true.
So when I saw Ashley, I was like, "Remember Umpty Ump?" And she was like, "Yes." I said, "She's peeling. The 3-step is working for her." And we were like so excited. So
Yeah.
we really do cheer for everybody behind the scenes, and you all don't see that, but we all care and we all play a role and part in that.
Yeah.
Yeah. So, and I love that.
Me too.
Yeah.
I think it's better for patients, stronger together
Absolutely.
and all the things.
Absolutely. Yes.
All right.
Yes.
Tracy, do you have anything else to add?
No, this was great. You do great. I could just sit here and just be, yeah. Oh, yeah, yeah.
Um,
You're perfect.
well, I have to talk less.
No.
Anyway,
Go
and
ahead.
like it's
Do
so
all the
funny
talking.
because I'm such an introvert. Now I'm gonna go home and be like, I've used all my words that I can use for a day.
And it's funny you say that you're an introvert because I'm like, you're really not. But because you can be in a crowd and you just own it. And I'm like, oh yeah, she's an introvert, all right.
No, but then I go
But
home.
you
Well,
go home
ask
and
Josh, but
crash.
then I'll go home and I'll be like,
Don't talk to
I'm
me.
gonna sit here for a minute. Shh. Anyway, so I really appreciate you spending your time with
Yes,
us
thank
and
you.
talking through this. And hopefully you subscribe and let us know what you think or any topics that you'd be interested in hearing us discuss about
Yes.
medical aesthetics. But we've got some really cool and interesting ideas for episodes to come up in the future. So,
Yes.
um, just thanks for spending your time, and we will see you soon.
Thank you. Bye. I drew a blank at that last one, so I was like, I'm so glad you took that. I was like, no,